my name's Emily, and today I'll be walking you through my research proposal, which is titled as The Impact of Psychological Interventions on Return to Play Outcomes in Rugby League Athletes Following ACL Reconstruction. So, this topic brings together sports psychology, rehabilitation, and performance analysis to tackle a growing concern in elite contact sports: how to best support athletes not only physically but mentally through their injury recovery. ACL injuries are unfortunately really common in high contact sports like rugby league. The ACL, also known as anterior cruciate ligament, is vital for knee stability, and ruptures can take anywhere from 9 to 12 months or more to fully recover from. While physiotherapy is While physiotherapy and surgery have advanced significantly, a major issue still remains as many players struggle to return to their pre-injury level of play. Research by Arden 2014 shows that fear of re-injury, loss of confidence, and reduced motivation are major reasons why players don't make it back, even when their body is physically ready. Webster 2018 adds that psychological readiness is one of the strongest predictors of return to play success, often more so than physical recovery markers. So, what we need to ask is, are we actually doing enough to help players mentally recover, not just physically? So, that leads me to the purpose of this research. The aim is to evaluate whether structured psychological interventions such as cognitive behavior therapy, guided imagery, and goal setting can improve return to play outcomes in professional rugby league athletes following their ACL reconstruction. So I have three objectives today, and they are to compare return to play rates and timelines between athletes who receive psychological support and those who don't. Number two, to assess psychological readiness using validated tools like the ASL, RSI, and the Tampa scale for kinesphobia. And number three, to explore athletes' lived experiences with psychological support through semi-structured interviews. And my research question guiding this study is, does the inclusion of psychological interventions improve return to play outcomes in rugby league players recovering from ACL injuries? So what does the existing research tell us is that there's a lot of support. A lot of people support the idea of psychological barriers and significant delay recovery. Arden 2014 found that over 50% of athletes didn't return to pre-injury levels, largely due to fear of re-injury. So similar to that, Philby 2018 found that even after successful surgeries, many athletes still feel uncertain, anxious, and disconnected from their sport. In terms of interventions, Kupel and Brewer 2001 were among the first to show that relaxation and imagery techniques could reduce pain and anxiety in injured athletes. But more recently, Corondo 2018 found that CBD-based approaches improved coping mechanisms and recovery outlook in ACL patients. However, there are key gaps. Firstly, most research isn't rugby league specific. This sport has unique physical and psychological demands that aren't covered in general studies, as Morris 2019 found. Second, many studies lack long-term follow-up qualitative insight into how athletes actually experience recovery. And third and final, there's very little consistency in how interventions are delivered, making it hard to assess their full impact, as Johnson 2020 found. So my research aims to fill these gaps using a mixed methods approach that blends stats with real-world athletes' voices. So this study uses a mixed methods longitudinal cohort design, which allows for both statistical analysis and deeper insight from interviews. So participants will include 30 male professional NRL players aged between 18 years old and 35 years old within 2 months post ACL reconstruction. They'll be divided into 2 groups. The intervention group receives standard physiotherapy plus a 12-week psychological support program, including CBD, guided imagery, relaxation training, and weekly goal setting. The control group gets physiotherapy just by itself. So quantitative tools will include ACL RSI, which is to measure psychological readiness, Tampa scale for kinesphobia, which is to measure the fear of re-injury, and return to play timelines. Qualitative data will come from semi-structured interviews conducted at weeks 4, 8, 12, and post-RTP. These will explore emotional responses, coping strategies, and perceptions of the interventions. So by combining these data types, I can draw stronger, more practical conclusions that reflect both performance outcomes and personal experiences. So for the quantitative data, I'll use repeated measures, ANOVA, to track changes over time across both groups. Kaplan-Meier's survival analysis to examine return to play timelines. And for the qualitative data, I'll use the thematic analysis as outlined by Brunner and Clark, 2006. This will help me identify key patterns and themes in athletes' experiences like motivation, stress management, and overall their confidence. Ethically, this study will follow all HREC standards. All participants will be given informed consent, and data will be anonymous and stored coding in qualitative analysis. Triangulating both data types strengthens the reliability of the study. In conclusion, this research could make a meaningful contribution to the way we support our injured athletes, not just in rugby league, but potentially across over other high contact sports as well. If psychological interventions are shown to improve return to play outcomes, rehab teams may start to incorporate sports psychologists as standard practice. That supports the bioscopical model of rehab where mental health is seen as just as important as physical recovery. Mean Wanning 2010. This study may also help reduce re-injury rates, improve athletes' well-being, and empower athletes with mental tools that they can use after recovery, well long after recovery. Ultimately, the findings aim to shift injury rehab from being purely physical to something more holistic, athlete-centered, and overall sustainability. So these are the references that I've used in my presentation. Thank you very much for listening, and yeah, enjoy.